Basically, the subject is economic inactivity in the United Kingdom.
It is. Thank you, Brian. Yes, this is from the NHS Confederation, published this summer, 25th of June. And really what they're pointing out, I mean, well, first of all, economic inactivity encompasses all those people who, for one reason or another, are not part of the UK labour market. They're not part of the workforce. But the specific trend here is long-term sickness. And this is what sort of is being discussed. Now, it is really euphemistic for the time period covered by the largest pharmaceutical trial ever conducted. It does overlap exactly with it. So we'll just look at what some of the text from this thing from the NHS Confederation. They say following an historic low prior to the pandemic, the number of people out of the workforce in the UK has risen by 900,000. There are now 2.8 million economically inactive, long-term sick, about a third of the total inactive population. Now, this is absolutely considerable, and the degree to which it correlates with changes imposed by government, either via enforced internments or indeed effectively mandated pharmaceutical products, is significant. So that's not to be ignored. The next slide shows a graph indicating not just the degree to which long-term sickness has gone up, you see on the right 85%, but also how the fracturing of our way of life and in particular the family unit has taken hold. And we see that there's been a 32% decrease in the number of those who are economically inactive because they are looking after their family or looking after their home. And I think that's, again, another very significant factor, which has accelerated hugely after 2020, where there was a very deliberate push to affect the way that society would behave, not just then, but also in the future. And again, further graphs illustrate the effect on the working age population. Now, these are supposed to show effectively comorbidity, so the numbers of different conditions that people have, with the darker line at the top representing people who have 5 or more health conditions that are known about. Of course, there are going to be a lot of people that presumably are not captured by this data because they're not known about. Most alarming, I would say, on the left-hand side is the younger age group, 16 to 24, and you can see a dotted line before 2020. So this is a trend that has been in the pipeline, accelerated no doubt by the factors I've just mentioned. But it is very alarming to think that people who should be in the prime of their life are being affected in such a manner that they are prevented from working or choosing not to work. So I don't want to make assumptions that people are not joining the workforce because they are unable to, and long-term sickness itself is a definition that should be open to some considerable scrutiny, given the way that it's possible to manipulate the benefit system in the UK and, of course, survive. Although, of course, I'm not in any way dismissing genuine sickness. Now, we'll just look at what the Labour Party said about this, and I think quite a telling statement. They talk about the NHS becoming not just a sickness service, but to prevent ill health in the first place. And they say that they must reflect, tellingly, that it must also reflect the change in the nature of disease, with a greater focus on the management of chronic long-term conditions. Okay, so they're addressing what is happening, but certainly not what has caused it to happen. And I think that phrase, change in the nature of disease, is very, very significant when, again, one considers the pharmaceutical products that have been, in effect, enforced upon people over the last 4 years. So sort of concurrent with this, we see this relentless push towards the suggestion that ill health is normal, chronic ill health is normal. And further, in the next slide, we look at terminal illness, and we've got the change, and this was specifically with regard to the benefit systems, but the way in which that ill health and terminal illness is being looked at. So Disability Rights UK, pointing out the definition of terminally ill has been changed. So the next slide showed us that in 2023, for the purposes of these benefits, to be terminally ill, you were either suffering from a progressive disease, you were suffering from a progressive disease, and your death as a result of that disease can reasonably be expected within 12 months. Well, this is going to capture an awful lot of people if, of course, the suggestion is that it is progressive and there's nothing that can be done about it. So it is an ill health service, but it's very much normalizing this idea that people are going to be draining resources. This is something that Mike Robinson talked about the other day, and specifically the article that Matthew Parris had published about this, about effectively warming people up to the idea that they mustn't be a burden on society, they mustn't be a burden on their family. And I refer back to the graph earlier showing the decrease in the number of people who are taking time to look after family members. And all this gets wrapped up. And of course, the next thing we then look at is the assisted dying bill, which is come back. You know, this has been on the cards since Lord Faulkner first dealt with it years ago. And we see again, it was debated back in July, 26th of July of this year. So there is a relentless push towards this. And then, of course, the other thing that we have to be mindful of is the way that all this is reported in terms of the government managing the statistics, in particular, where it concerns death. So this is the chart showing the total deaths from the Office of National Statistics, just released yesterday. And we've talked about this a lot before, but it must be pointed out again that the dotted line that runs either sort of along the top of or just above or just below the bars of the chart is what's called the expected death sort of predictor. So this was changed. It used to be the 5-year average, and it's now written down as expected deaths. Now, what I've done is put a red line across the graph to make it slightly more obvious that, in effect, this is absolute manipulation of statistics in order for the government to be able to try to convince the population that there isn't a problem. And if you look at July 2023, which is roughly in the middle of the chart, so approximately a year ago, you can see quite clearly when you look towards on the right towards 2024, the expected death tally has been increased enormously, but no good reason given for this. So, as I say, this whole idea that that death, or at least chronic illness, is becoming normal, and indeed that assisted dying and all the rest of it should very much become part of the way of things, but at the same time is suggesting that people aren't dying in huge numbers for reasons that are unknown. And I'll just close out this segment by talking about something that actually came through the post the day before yesterday. So actually, I don't know if we can just go back one, because it just the image first of all. Oh well, never mind. But basically, it's the Royal Mail have partnered with something called Pharmacy to You, and this is to enable prescription drugs to be delivered without anyone having to do anything. And the key bit of text from this advert, which has been put all over the place to encourage people to take it up, is it says, simply register and order your prescription through our website or the Royal Mail Health app. We'll then deliver it safely and securely for free. So those key words, safe and secure. And then, of course, it's free. Well, we've heard all that before with many, many other things. Register below and we'll take care of the rest. We'll even send handy reminders so you never run out. It's as easy as that. So again, this is something that Debbie Evans has talked about a lot, the way in which the delivery of what's being called health, but isn't, is being affected by technology and continuing to isolate people, keeping them in their homes with absolutely no review as to whether they require these drugs or not, but they are simply going to have them forced down, forced into their homes effectively by suggesting that it's all too easy and it's safe and secure, like so many other things. So a gloomy outlook, really, in terms of health or sickness, but certainly in terms of the way in which the economy is likely to go as a result of this. And again, the thing to keep our eye on really is where this ends up with assisted dying.
Charles, thank you for that. A heavy subject, particularly to end today's news on, but this is the reality of what's happening in this country, and the wider public need to know about it. And I am just going to say, for many people who now realise the very serious things happening in this country, some people are finding it almost overwhelming as all of these very dark agendas come in, that taking simple actions can make such a difference. So if you're somebody who has never emailed your MP or challenged a local councillor or attended a local meeting, if you do this and take action to challenge what is actually happening around you, We say that you will feel better. We certainly did in the early days. And of course, if you can make friends of other like-minded people so that you go with other people to challenge the system and its flawed agenda, you will feel even better. So what is required is hundreds of thousands of people doing a little thing instead of a small number of people trying to do a lot. It's that simple. And we'll end by saying that, of course, the people who are falling into the trap of engaging in violence are simply helping the state in its closed down agenda. So if you want proper change out of Keir Starmer's Stasi state, find a friend and take the establishment to task in a peaceful, reasonable way. We'll end there. Vanessa, thank you very much for joining us today, as always, and to your good self, Charles. We'll end the news. It's been slightly extended news today, which hopefully is made up from our lack of a live broadcast. But I'm hoping that when I speak to the team in a moment, we might be able to do a UK column extra. So do look out for that. We'll do it if we can. Thanks for joining us. Bye-bye.
Bye.
Bye.